Hello viewers, welcome back to my channel. I am Dr. Anglina D'Costa. In today's video I will discuss 4 sex positions for female orgasm. Female orgasm is not a mystery, nor is it something rare or abnormal. From a medical point of view, it is a natural biological response influenced by anatomy, hormones, blood circulation, nerve sensitivity, emotional comfort, and overall health. Unfortunately, many women grow up without proper education about their own bodies, which leads to confusion, guilt, or unnecessary anxiety around pleasure. Science shows that the female body is designed for pleasure through a complex network of nerves, especially around the clitoral region, pelvic muscles, and brain pathways. When blood flow increases and muscles are relaxed, sensitivity naturally improves. Equally important is the role of the brain. Stress, fear, fatigue, and emotional disconnect can block pleasure signals, while safety, trust, and comfort enhance them. Medical research also confirms that every woman's experience is different. There is no normal time frame or single method to reach orgasm. What matters most is comfort, communication, and understanding one's own body. Pain, pressure, or discomfort should never be ignored, as these are signals that something needs attention. As a doctor, I emphasize that female orgasms are a part of overall wellness. Healthy sleep, balanced hormones, hydration, emotional connection, and pelvic health all contribute. Pleasure should never feel forced or rushed. When approached with respect and knowledge, intimacy becomes a positive and healthy experience. Before we dive in, let me quickly ask you to support this channel. Give this video a like, drop a comment below telling me where you are watching from, and hit that subscribe button so you never miss my latest men's health updates. Let's get started. Firstly, let's see what science says behind female orgasms. From a scientific and medical perspective, female orgasm is a coordinated response involving the brain, nervous system, blood vessels, muscles, and hormones. It is not limited to one organ or one sensation. Research shows that pleasure begins in the brain, where signals of safety, desire, and relaxation allow the body to respond naturally. When a woman becomes aroused, blood flow increases to the pelvic region. This improved circulation heightens sensitivity in nerve-rich areas and supports natural lubrication. At the same time, the pelvic floor muscles begin to engage in gentle rhythmic contractions, which are part of a healthy orgasmic response. These muscle movements are involuntary and indicate proper nerve function. Hormones also play an important role. Oxytocin, often called the bonding hormone, supports emotional connection and relaxation, while estrogen helps maintain tissue sensitivity and blood flow. Stress hormones, on the other hand, can suppress arousal by tightening muscles and reducing circulation. Medical studies confirm that comfort, positioning, and emotional safety directly affect these biological processes. Pain, anxiety, or distraction interrupts nerve signaling and reduces pleasure. This is why relaxation and communication are essential. As a doctor, I want to emphasize that female orgasms are a sign of healthy mind-body coordination. They vary from woman to woman and can change with age, health, and life stages. Understanding the science helps remove fear, pressure, and unrealistic expectations. Now let's begin with position number 1, woman on top, maximum control and comfort. From a medical and scientific point of view, the woman on top position is one of the most effective positions for improving female comfort and orgasm potential. Research in sexual health shows that when a woman has control over movement, rhythm, and depth, the body responds more naturally and positively. This position allows a woman to adjust her posture according to what feels comfortable, reducing unnecessary pressure on the lower back, hips, and pelvic floor. Proper alignment helps improve blood flow to sensitive areas, which is essential for arousal and orgasm. When circulation is optimal, nerve sensitivity increases and muscle tension decreases. Another important benefit is reduced performance pressure. Because the woman controls pace and movement, anxiety levels are lower, allowing the brain to remain relaxed. Science confirms that relaxation is critical for pleasure, as stress hormones can block the body's natural responses. This position also supports better communication between partners. Subtle changes in movement or posture can be made without discomfort, helping the body respond naturally rather than forcefully. As a doctor, I often explain that comfort is not optional, it is essential. Pain or strain interrupts nerve signals and reduces pleasure. The woman on top position supports healthy pelvic function, emotional ease, and physical comfort, making it a medically sound choice for many women. Next I will discuss position number 2, face-to-face connection. From a scientific perspective, the face-to-face position supports female orgasms by strengthening emotional connection and hormonal balance. Medical research confirms that emotional safety and bonding play a major role in female pleasure. When partners are emotionally connected, the brain releases oxytocin, a hormone linked to trust, relaxation, and deeper intimacy. This position allows eye contact, natural communication, and synchronized breathing, all of which help calm the nervous system. A relaxed nervous system improves blood circulation to the pelvic region and allows nerve signals to travel smoothly, which is essential for orgasm. Reduced stress also lowers cortisol levels, a hormone known to block arousal when elevated. Face-to-face positioning promotes comfort and awareness of each other's responses, making it easier to adjust movements without discomfort. From a doctor's point of view, this position highlights that female pleasure is not only physical but also emotional. When the mind feels safe and connected, the body responds more positively. Now let's see, number 3 position. Side-lying position. Relaxed pelvic muscles. From a medical standpoint, the side-lying position is one of the most comfortable and body-friendly positions for female pleasure. Scientific studies show that when the pelvic floor muscles are relaxed, blood flow improves and nerve sensitivity increases, both of which are essential for orgasm. This position naturally reduces muscle tension and joint strain. Side-lying is especially helpful for women who experience lower back pain, hip discomfort, fatigue, or hormonal changes. Because the spine remains neutral and the body is fully supported, the nervous system stays calm. A relaxed nervous system allows pleasure signals to travel more efficiently between the body and the brain. Another benefit is sustained comfort over time. There is no pressure on the knees or abdomen, making it suitable for longer intimacy without exhaustion. As a doctor, I often remind patients that comfort and relaxation are key to healthy sexual response. When the body feels supported and stress-free, pleasure becomes more natural and achievable. Now let's move on to position number 4, supported pelvic elevation. I will explain. Supported pelvic elevation is a position that enhances comfort and improves natural stimulation by optimizing pelvic alignment. Scientific understanding of female anatomy shows that a slight elevation of the pelvis can change internal angles, allowing better blood flow and nerve responsiveness in sensitive areas. When the pelvis is gently supported, using a cushion or natural body positioning, the pelvic floor muscles can remain relaxed, rather than strained. Relaxed muscles improve circulation and reduce pressure, which supports a healthier orgasmic response. This position is especially beneficial for women who experience lower back discomfort, stiffness, or reduced flexibility. Pelvic elevation also reduces physical effort, allowing the body to focus on sensation, rather than balance or endurance. From a doctor's viewpoint, this position highlights the importance of comfort and proper body support. When the body feels aligned and relaxed, pleasure becomes a natural outcome rather than something forced. So there you have it, viewers. Dr. Anglina D'Costa signing off this video. From a medical perspective, healthy intimacy should always be based on comfort, communication, and mutual respect. There is no single position or method that works the same for every woman. Listening to your body, staying relaxed, and feeling emotionally safe are essential for a positive sexual response. Pain, discomfort, or anxiety are signs that something needs attention and should never be ignored. Maintaining overall health through proper sleep, hydration, stress management, and hormonal balance also supports sexual wellness. Thank you for joining me. If you found this video helpful, don't forget to like, share, and subscribe for more natural health tips designed especially for seniors. Thanks for watching.